What is genetic counselling? Now, please don't worry if you haven't actually heard about it before or only have a vague idea of what it is, because it is still a relatively young health profession. It only really emerged in Australia in the late 1980s. So throughout the last 3 decades, there's been a lot of work going on to define genetic counselling and formalise the role, the training and the certification leading to this profession. So now internationally, the widely accepted definition is exactly what's on the screen. So genetic counselling is a communication process which aims to help individuals, couples and families understand and adapt to the medical, psychological, familial and reproductive implications of the genetic contribution to specific health conditions. Now that's quite a mouthful, isn't it? So if we break it down into a few different chunks, it's a whole process. You know, it's not one single thing. It's a process combining lots of different elements. And those elements include interpreting family and medical histories to assess the chance of a disease actually happening or happening in future generations. It's also education about the natural history of the condition, the inheritance pattern, which can be particularly complex when it comes to mito, genetic testing, management, prevention, support resources and research. So there's a lot of our sessions do go into education, sharing our knowledge with people living with a condition. And something I often think of is that genetic counsellors in some ways are a bit like translators. They can translate medical speak into plain English. So their goal is really to help people understand some of these complex terms, some of these tests involved, and take the time to sit with you so that you learn about the condition or the diagnosis. Now, the counselling aspect is all about promoting informed choice. And those choices might be relating to the risk assessment, family goals, ethical, religious values. It's really having a chat to figure out who is the person in front of us, what's important to them, how can we best support them to be able to make decisions that are right for them? Because not everybody will make the same decision. We all come to a genetic counselling appointment bringing our own values, our own priorities and life experience. Now, another important aspect is supporting people to encourage the best possible adjustment to a disease or disorder in either themselves or an affected family member. So in many cases, receiving a genetic diagnosis can come as quite a shock. It can be distressing, whereas for other people, it can actually be the relief after a long diagnostic journey of finally having some answers. So whatever the emotions are in response to that, we're there to support and help that adaptation. And also for anyone that might be considering children, discussions can include the risk of passing a condition on to any future children, or even testing options, whether they exist or not for existing children, and exploring any reproductive options that may exist. So what genetic counselling is not, it is not us telling you what to do or how to decide on any particular decision. We do not make decisions for you. Our role is to help you reach a decision that is appropriate for you and your family. And after any genetic counselling session, it's hoped that you have the information that you need and have considered how you feel about a wide range of options so that you can decide what is right for you. Now, it's also not a lecture on genetics, or at least it shouldn't be anyway. So don't go expecting that it's going to be an hour-long lesson or class on DNA and the structure of that. What we do know is that lots of people differ with the amount of information that they want or need to make decisions. And generally, genetic counsellors are skilled with helping people figure out what the right amount of information is for them and deliver it in a way that is understandable for them, okay? So for some people, they want a lot of information. For others, they might reach a decision through exploring different scenarios, or how would you feel if, and what would happen when, and exploring different scenarios like that. Genetic counselling is also not the same as going to a counsellor or a psychologist. So there's a lot more involved than simply talking about feelings or exploring scenarios. Now, any traditional genetic services clinic or team may include a range of different health professionals. And this slide is really more geared towards your larger public state genetic services. So there will usually be several genetic counsellors on board. Now, some genetic counsellors specialise in particular areas where it might be prenatal, it might be cancer, it might be paediatric genetics. Others are quite general and encompass all areas of genetics. Now, a clinical geneticist is a very different role from a genetic counsellor. Clinical geneticists are highly trained medical doctors that have already completed all of their medical training and completed an initial specialty. Usually, well, maybe not usually, very often they are already paediatricians, general physicians, sometimes oncologists, sometimes other specialists such as neurologists, ophthalmologists, gastroenterologists. So these incredibly intelligent people have already got one medical specialty under their belt and then do further training into genetics. A clinical geneticist is always involved if you are seeking a diagnosis, because genetic counsellors do not make diagnoses. They simply interpret or help you understand an existing diagnosis. Now, in some genetic services, there may also be social workers present. These social workers then generally tend to be very experienced working with people with genetic conditions, and they sort of work alongside the genetic counsellors to provide additional psychosocial support, recommending support groups and helping people living with their condition. And multidisciplinary teams. Now, this again is very service dependent, but many genetic services will work very closely with specialists in various different fields. So particularly when it comes to mito, a genetic clinic dealing with mito patients may also have a metabolic physician on board, or they may also be reviewing difficult cases or diagnoses with a neurologist. So we often have what we call case conference or multidisciplinary team meetings where sort of cases or people that are a little different or have some unique characteristics might be discussed in further detail. So it's just another wonderful opportunity where you're getting incredible minds all collaborating and reviewing details together. So some reasons why people within the mito community might see genetic services, I've kind of divided these into sort of three main areas. Now, there might be people that are still on their journey trying to seek a diagnosis. Now, maybe in the past, genetic testing happened later down the track, but with all this new technology and costs coming down, we're starting to see that sometimes genetic testing is done earlier in a diagnosis journey. So it could be that you might just have suspected mito, and it could be that your specialist decides to refer you for genetic testing and a review early on in your journey. Now, if that is the case, there will absolutely be a geneticist involved, and it might even be that there's no genetic counsellor involved until a diagnosis is reached. So that's one sort of area in which mito community might be seeking genetic services. In terms of newly diagnosed, something that we're seeing more and more of now is that other medical specialists, such as neurologists, might be ordering genetic tests for their patients themselves. So they might go through some options for genetic testing, but in some situations, a result comes back that's actually quite difficult to interpret. And then the neurologist or other specialist refer a patient with a new result to genetic services to be able to go into that result a little bit more detail. Now, sometimes that happens when a genetic change has been identified by a lab, but it's not very well understood and there's not a whole lot of information out there. So in those situations, genetic counsellors are quite skilled in explaining the uncertainty and talking about further options, whether it might be further options with testing or what that result means in isolation. Sometimes you may have already got a diagnosis through your existing medical specialist, but having a referral to genetics can give you a lot more understanding about the condition, particularly about the inheritance. I had mentioned earlier that when it comes to mitochondrial disease, inheritance can be quite challenging. And that's because genetic conditions are inherited in many different ways. And the different types of mito are one of the very few out there that basically any type of inheritance pattern is seen with some type of mitochondrial disease. So there's multiple different types. It can get quite challenging, but we can explain what is relevant for your particular type of mito. Another important thing for someone that may have more recently received a diagnosis is they might want to understand, did this come from a family member? Do I have other family members at risk? Should my other family members be monitored or tested or any surveillance for them? Or perhaps they're thinking about future children as well and want to understand what are the chances of me passing this on. And there's also a role for genetics in someone that may have received a diagnosis a long time ago. Something we do a lot of in genetics is review previous cases, review previous diagnoses or previous genetic tests. We'll always review what are the current guidelines and have a discussion on how to manage a condition based on the best available knowledge today. Reproductive options is another one. Somebody may have been diagnosed with mito during their adolescence. And of course, most teenagers are really not thinking about family planning, but perhaps a decade or so later, they are wanting to understand what options do they have to either avoid passing on mitochondria if possible, or to test in pregnancy, or what other options exist. So depending on someone's values, depending on the type of mito, the genetic change that's been identified, there are different options available to be discussed. And another time that someone with mito might come and see us is if there's any challenges or difficulty in talking to relatives or family members about mito, about what it might mean for them, about well, really anything that family members want to know or ask. And if there's any of those challenging family communication there, we're highly trained in family communication methods and can assist with talking with family members. So just to recap with where we're at so far, I've had a bit of a chat about the role of genetic counsellors, who they work with at Genetic Services, and why someone with mito might actually seek an appointment.